Good evening and welcome to our panel discussion in commemoration of World Suicide Prevention Day. This was celebrated on September 10th, 2022 at Millennium Heights Medical Complex. We're here to present to you a panel discussion with some of our professionals from the complex. This evening we have three panelists with us representing the National Mental Wellness Center and Turning Point Rehabilitation Center. We're going to speak on the theme, Suicide Prevention, Creating Hope Through Action. Tonight, I will start with Mr. Robert Huggins, who will introduce himself. Mr. Huggins?
Greetings, everyone. My name is Robert Huggins. I'm the program lead and head counselor for Turning Point Drug and Alcohol Rehabilitation and Detoxification Center. We basically work with clients to help them manage substance use issues and help them find their life of sobriety once again. It's a pleasure to be here. Thank you for having me.
Thank you, Mr. Huggins. Now, Mrs. Edward will introduce herself from the National Mental Wellness Center.
Hi, good evening, everyone. My name is Alison Joseph Edward. I am the clinical counselor at the Mental Health and Wellness Center.
And Mr. Bradley Joseph of Turning Point.
Hello, good day, everyone. My name is Bradley Joseph. I'm the social worker attached to the Millennium Heights Medical Complex. Well, I'm also attached to Turning Point. Like Mr. Robert Huggins indicated, we provide support for persons who may be suffering from substance abuse.
Okay, so this evening, like I said, we're going to be speaking about suicide prevention. And we don't have a lot of time, so we will get right into it with what is suicide and suicidal ideations. We have three professionals with us here, like I said. So I will open the floor to any one of them right now with that starting question.
So, do you want to lead us or shall?
It doesn't matter. Well, we could talk about what suicide is. You said what is suicide and suicide ideation. Basically, suicide is a self-injurious act that is basically fatal. It's the act of killing oneself. It's a simple explanation. And with suicide ideation, the individual have thoughts of committing suicide, thoughts of injuring themselves, and these thoughts are sometimes carried out or accompanied with a plan.
Okay, so let me just emphasize that the reason why we are doing this is because suicide and suicide ideation is actually quite prevalent in our country, contrary to what many people might think, because it's not right in front of their faces. So we have to make sure that this resource is in the beginning of the panel discussion, that we discuss what other resources are available for suicide prevention in the country. Bradley?
Well, one of the immediate resources we provide is the helpline, suicide prevention helpline. The contact number is 203. So we have professionals on board who provide crisis intervention, and also they also prepare referrals to a clinical counselor or any further support as well.
And it's important to note that it's a 24-hour service.
Right, 24-hour service.
And it's a free or toll-free call, so there's no charge to you.
Yeah.
Okay, and what can people, I know you briefly mentioned it, but what can people expect when they call? I'm sure there are people who are nervous, especially young people, and we do find quite a few cases from secondary schools in the country. What can they expect when they call? Should they be afraid?
Well, I mean, of course, persons who may suffer with suicide ideation, they may feel some form of hesitance. But on the helpline, there's confidentiality, there's a high level of confidentiality. So your information would be secure and so forth. And we have persons that also provide emotional support. You understand? So to be empathetic towards the individual and also direct them to whatever necessary resources that they may need. So in other words, they basically provide a safe confidential environment for that individual who may suffer with ideation.
Okay, and what about the resources at the National Mental Wellness Center? What can we say about that?
Yeah, so that's all part of the resources. But what do we have at the National Mental Wellness Center in relation to suicide, and we all are here, is psychiatric assistance evaluations and also psychosocial evaluations. So somebody thinking or having suicide ideations and wanting the help that they need, they could also, besides calling 203, which is very good and a very important resource, they could also come in to the wellness center and discuss how they're feeling, and coming to our free clinic that's available. And that clinic is available on Tuesdays, Wednesdays, and Thursdays from 8 o'clock to 1 p.m. So the individual could just walk in on these clinic days, and there they see the nurse, they get evaluated, and then they get to see the psychiatrist. Once you see the psychiatrist, and the psychiatrist will come up with a diagnosis, whether it's depression, which is one of the main reasons for people wanting to feel that way, besides the other reasons. Other reasons include substance abuse. So they would come and get a psychiatric evaluation, and then after that, a counselor will be recommended. And it's a multidisciplinary, multifactorial approach, and also besides getting evaluated, besides seeing a counselor, if there is a need, especially in the case of minors, if there's a need for social investigation or social intervention, then a social worker will also be on board to help that client.
So that clinic from 8 to 1, 8 to 1,
Yes.
is it really a walk-in clinic, or do you have to get referrals from your primary health care for that service as well?
You don't need a referral for the primary health care. It's available to St. Lucian's, and it is a walk-in clinic. You could actually come in there if you're not feeling well, and I think it's important that St. Lucian's understand that there is this resource, this important resource there in terms of your mental health.
Okay, so we'll get to Mr. Huggins in a little bit. He has a lot to say, trust me. But let's go into how culture and tradition influences our approach to suicide. Previously, I mentioned that we do find a large number of calls sometimes in the year at the helpline from a younger population. And we also know that there are people who don't always come out or feel comfortable speaking to someone about those things. And we all understand that culture and tradition has a big part to play in that. So how does this influence our approach as a country, as a society, to suicide and suicide ideations?
Well, I guess it has to do with the stigma attached to the whole idea of, mental health in general. So, the society, as a result of lack of education or knowledge about what mental health is, how it could affect us, and even the services that is out there, that level of stigma, it could basically influence persons' behaviors and thoughts, and even maybe the way they react to an individual. So it could also be a case where you have professionals as well may have that type of stigma towards individuals, and that could be a major barrier that prevent persons from seeking help, and even in the case with their families, in terms of their whole idea of what that stigma is or what suicide is. You understand? It could be a fear of shame.
Yeah, and guilt.
Shame, guilt. You brought shame to the family's name and so forth. So these are some of the factors.
I want to kind of build on that as well, because when we speak about stigma, and especially with mental health issues within the Caribbean, the issue being that we tend to, or in the Caribbean, we've carried a very moralistic view of what mental health is, mental wellness is rather. The idea being, and this is linked very much to addiction issues as well, issues of substance use disorders and whatnot. But the idea being that it is people of weak mind who suffer from these things, and it's a matter of if they put their mind to it, they can recover. Not recognizing that these issues, these illnesses, depression, addiction, all these things, they are clear medical illnesses. We can actually show pathways in the brain where that has been affected, and we know that they are medical diseases, right? These diseases just happen to affect the brain and can affect personality and everything else as well. So, because we carry this moralistic view, there's, as Mr. Joseph said, there's a lot of shame and guilt when it comes to when we suffer from these things, and we don't want to come forward and get the help that we want, right? So you find people turn to other resources, right? Resources that don't necessarily work. So they may turn to a spiritual leader, or they may use some sort of herbal medication or try other avenues. And do not get me wrong, I'm not discounting the value of these things. If these things are within your belief, I'm not saying that they're wrong. I'm simply saying that there's a certain point where you recognize they're not having the effect that they should, then you have to recognize, look, I need to go and get a different kind of help. And that's where psychology, psychiatry comes into play, right? So when these other methods aren't working out, then you say, okay, this is not that type of issue, let's move on to something else and get that help. And recognize it for what it is, which is a disease and not a choice, as it were.
Yeah, and I also would like to build upon it too. So the whole aspect of it's important that they recognize that, and it's important that they get the help that they need. But the important thing is that both of you mentioned is the whole aspect of the stigma. So besides the stigma, so there's a stigma within the communities about the mental health. The people feel that they will be treated differently if they come out and speak and try to get help in relation to their mental health. But besides that, there is their own personal stigma that they have on themselves. People who actually suffer from mental health conditions or mental health challenges, these people actually feel as they have a low self-esteem for one. And all of these things are preventing them from getting the adequate help that they need when it comes to suicidal ideation and those strong feelings of wanting to end their lives. And besides that, we also have the societal stigma. This is a different kind of stigma where some of the opportunities for people with mental health challenges are very limited. So these are some of the things that we have to look at when we speak about stigma. We have to look at the stigma, the individual stigma, we have to look at the community stigma as a whole, and we have to look at the whole societal stigma. What opportunities are there for these people in terms of the community? What are the legislation? What are they doing in terms of protecting these vulnerable people, especially those with severe mental health conditions?
Okay, so one of the definite indicators of our culture and traditional influence on our approach to suicide is the fact that people classify it as weak in general. We definitely said that.
Or we blame it on a curse or possession or some sort of spiritual
or the devil.
factor.
Yeah,
Or something
I've had that a lot.
And I do want to mention that some of the things that you did mention that people try do make it into some of our treatments at the mental wellness center and at Turning Point. So for example, the spiritual aspect and the healthy eating, and they do make it to some of our treatments. It's not that it's completely void, but we're emphasizing that it's a disease and it's a disease of the mind. So it has to be treated as something that's mental. But a lot of our stigma kind of, discombobulates why people commit suicide. People have a lot of ideas, and sometimes we never know. And people have a lot of rumors, a lot of things saying, and the person who is actually suffering from the disease doesn't have the opportunity or feels afraid to explain how they're feeling. So can we go into why people commit suicide or why people attempt to commit suicide? And can we kind of narrow it down on our culture in St. Lucia? Why do people commit suicide?
So we could also look at the aspect. There are many reasons why, and I know all of us would come up with some of the reasons why people commit suicide. But in terms of the culture, let's look at the behavior of certain persons. For example, somebody found out that their partner was cheating, so they have GoPuel. Like we discussed. So there's the whole aspect of GoPuel happening, and instead of maybe comforting the individual, there is this jeering at the individual, laughing at the gentleman, say, oh, your wife horn you or your woman horn you, and these kind of things, and making it even, because I mean, a man going through that, somebody going through that, that this is a serious thing for the gentleman, but for the society, they jeer and they make fun of the individual. So it's the way we look at things from a cultural point of view, the way we behave in the society. When people are hurting, we sometimes, turn it into something like a joke when it's something serious. Yes. So that's one of the reasons why, that's one of the things, if you want to link culture to our behavior towards people who are hurting, that could cause that.
So the one thing I'll say just now is that we lack culture in a Caribbean, not culture, we lack research in a Caribbean context. So much of what we might bring up is based on observation by professionals in the field and whatnot.
By yourselves.
Yeah, so it's difficult to definitively say, well, this is the case, but she's very right in what she's saying. But I just want to make the point that, one area of weakness that we do have is a lack of research to sort of put a final point on what these issues are, where we should be focusing on that and that sort of thing. But internationally, if we look at the research, we know that depression and substance use are two of the major correlating factors related to suicidal ideation and attempts. So, I'm sorry, Mr. Joseph, go ahead.
Yeah. Well, especially in terms of excessive use of substance abuse, because even in terms of the international research, you find that substances that, for example, opioids and not opioids, heroin. I mean, that's one of the major leading causes of suicide as well. In terms of our culture, like you mentioned with the GoPro, like you mentioned, we have these other aspects in terms of the inability to express oneself, or to there's that again. You find a lot of persons may kind of chastise you for expressing yourself, and even when it comes to sexuality as well. You understand? Being able to express that side of you, that these factors could also lead to depression and suicide ideation as well. I had another factor, but it kind of slipped.
Well, there's quite a few more.
All that thoughts. We will get back to why people commit suicide and the most prevalent reasons why people commit suicide. So, since you couldn't remember what you wanted to say a while ago, try to remember it for after the break.
If you are in receipt of an abnormally high bill, it is highly possible that you have a leak. That leak may not always be visible. Before you contact WASCO, conduct a do-it-yourself test. 1. Record your meter reading. 2. Do not use water for 30 minutes to 1 hour. 3. Take another meter reading. If the reading changes, you have a leak. Contact a plumber to identify and fix the leak at the earliest. A message brought to you by the Water and Sewage Company Incorporated, WASCO.
So here are some of the
Welcome back to
reasons why.
our panel discussion, Suicide Prevention, Creating Hope Through Action.
some of the risk
You are with Millennium Heights Medical Complex this evening, and we have 3 professionals from the complex discussing the topic this evening. Before we went to a break, we had Mr. Bradley Joseph on the topic of why people commit suicide, and we were discussing some of the reasons and the prevalent reasons especially. And we noted that it was happening a lot among men.
Well, for me personally, or even dealing with persons on a daily basis, one of the most prevalent reasons would be socioeconomic status, or poverty, inability to provide for your family or necessary needs for yourself, and that could bring on a number of hosts of issues, you understand, which could lead to suicide as well.
And to sum that up, we could also put into different categories. So there are individual risk factors, there are also relationship risk factors, and there's also community risk factors why people commit suicide. In terms of community risk factors, an example may be that they have limited access to healthcare. For example, if even a place like, give me a place that is a remote place, and you've been having these suicidal ideations, I mean, and things are really tough economic-wise. You can't even have bus fare to come to the wellness center, or to find yourself to the nearest, wellness center. That could be a factor, access, finance. But in terms of the individual risk factors, somebody that has a history of depression in the family or mental illness, that could be a risk factor. Somebody that have a history, their own selves being repeatedly depressed with things like conditions like dysthymia. But the main reason why, the main factor is that somebody that has attempted suicide before. According to the World Health Organization, somebody that has attempted suicide before, and many other researchers, if you attempted suicide before, you had a greater risk of committing suicide. So there are many different reasons, but we could pull it up into lifestyle factors that are sometimes overwhelming for the individual, and it's just so hard to
Trauma
cope.
and abuse and all
Yeah.
these things.
Now, it's when you mentioned about the men and suicide. If I recall, the research indicates that more men actually tend to complete suicide, but more women attempt it.
Attempts,
Right? As to the factors or that contribute to that, some might suggest that the methods that men choose tend to be more violent and as a result, more successful in that sense, as opposed to women who might use other methods like overdosing on medication or other things, which allows time to be helped, right? So that's one thing to consider. So there are a lot of factors, and as Mr. Joseph mentioned as well, socioeconomic factors, because you get more people from lower income spectrum who will commit suicide as opposed to those from high income brackets. So these are things to be considered, and these are things, again, like I said, we rely very heavily on international data for. And I'm a person, I strongly believe in evidence-based approaches, and I think that if we as a country or a region, because it doesn't necessarily have to be St. Lucia alone, are serious about dealing with an issue, we need to commit ourselves to finding the data that reflects our own reality, so that we can make policies and put things in place to address that.
Yeah, but the thing about it, it's hard because I've been looking for myself, and the data even show that it's difficult to get concrete information when it comes to suicidal behaviors. Because according again to the World Health Organization, for every person who commits suicide, there are 4 persons who attempted. So the data, it's hard to get the data and to culminate the data and to put it together, because people face issues every day. And let's look at the whole aspect of the pandemic. It's quite interesting, like maybe some countries, like Guyana, has the highest rate of suicide per capita in the entire world now, but before it was Switzerland. And even the United States, when you look at the statistics, it's the 10th leading cause of suicide in the United States. Every 11 minutes somebody commits suicide. But the point of the matter is, look at in the pandemic, suicide rate dropped by 3% in the United States during the pandemic. But in other countries and in other cultures, so it has to do a lot of the cultures with the values. So that's why the data is not concrete. They cannot give a worldwide data in some of the habits. They could just give you the numbers in terms of the amount that was done. And even in St. Lucia here, I was trying to get the data in terms of the amount of persons that attempted. This is hard to do. I mean, people come to the office and it's then you know that they tried 2-3 times to kill themselves. But you wouldn't know that until you sit down in a therapeutic alliance with that particular client. So in terms of the attempts it had, in terms of the suicide, of course, there's the morgue, there's these things that you could find out. So there are limits there towards getting the data.
So it's important to note that there is no typical victim patient. There's no typical person who attempts or thinks about suicide or makes the plan. And I think that we should ensure that all of our listeners and viewers tonight, and anybody who might see this in the future, that they know that the Mental Wellness Center and the Suicide Helpline is always open to them, and it's open to anybody, and anybody can suffer from it.
Yes, yes,
So
that's true.
we do have indicators, we do have things that show that people might be more at risk than others.
Risk factors, yeah.
I think the World Health Organization did state that 1 in 3 people do think of suicide at some point in their life. So it's not something that's escaped. If it's not you, it's one of the other 3 people in your home might be thinking of it. So it's something that everybody should be prepared for. And with that, I think we should touch a little bit on the signs of suicide ideation or somebody about to attempt a suicide. Can we speak a little bit about that?
Yeah, so I could start and the gentlemen could follow. Ladies first, right? Yeah, so one of the things, one of the markers, the main markers of suicide is a major depressive episode. Because you're having a life event that's happening, maybe some issue that seems overwhelming for you, although there are other reasons, but one of it is that you're feeling depressed. So one of the signs, if you see somebody's feeling depressed, somebody's acting withdrawn, withdrawn from the community, withdrawn from the family, and this kind of thing, then you know that there is something is going on. So there's a sort of isolation happening. So then there's something going on. Okay, I know Mr. Huggins could talk about substance abuse in that area, because there are two sides to the substance abuse. Mr. Huggins,
so we can see an increase in substance use by individuals who are considering suicide. We can also see how changing their behaviors in such a way where they become more, not carefree, but careless about their the risk that they take. So drunk driving, overdosing, heavy use and that kind of thing, where they don't seem to care too much about the consequence of their use. At that point, they don't really care about the result or what happens with their life. So you might see them that start to use so heavily that it actually might cause harm, cause them to go to hospital and suffer the repercussions, harm themselves in certain ways as well. There are other factors outside of that as well, in terms of people who seem to be talking about suicide, who talk about how they might go about doing it, who may be stockpiling tools or things for that purpose, who seem to be putting their affairs in order, etc. These are signs and indications. But I always say, sometimes when we see signs, it doesn't mean because we see one thing means that we can diagnose based on seeing that one thing.
Yeah.
But when you see it, it's an opportunity to say, hey, let me talk to that person and see what's going on.
Yeah. And also another component is the fact that mental health disorders, some of the severe ones, like bipolar disorder, borderline personality disorder, schizophrenia, these kind of conditions actually bring about something like psychosis. And the psychosis, sometimes you hear the voices telling you to kill yourself. So it's not only from the mental health disorders, but it's also from the substance use. Because, and like I would say, and I think Lucia needs to know that, and I'm not trying to be controversial, but the fact is we try to decriminalize marijuana. But what these substances, marijuana especially, does is that over a period of time, it builds toxins into your system. And one of the effects of these toxins, sometimes you could go into psychosis. And psychosis simply means that that person is having delusions, or that individual is having hallucinations where they're hearing things or they're seeing things. So they're hearing voices or they're seeing things. It doesn't happen to everyone, but the persons that it happened to could have serious implications. And one of that, when you're hearing voices, a lot of them the voice is telling me to kill myself or to kill that person. So that's something that needs to be looked into. And again, with alcoholism, it brings upon depression. So after you had your alcohol and everything, after a while of constantly using alcohol, there's a condition where you get depressed, very depressed. So in terms of substance abuse, it's a two-sided thing. You either, because you're depressed, you take substances and you get to the point where you want to kill yourself, or you get depressed or you feel like killing yourself because of taking the alcohol. It's both sides. So this is something in relation to substance abuse.
And to add to that, most of these factors that were mentioned, all of them are linked in some form or fashion, because even with substance abuse and with suicide ideation, you might have persons may experience insomnia, might have difficulty sleeping and so forth. Also, they may lose interest in certain hobbies or things that they enjoy. You understand? So these are some of the signs. And also, in my experience, one of the signs I noticed was an individual who wrote a note.
Yeah.
They wrote a note about their death and so forth. So these are signs we could notice as well.
Yeah, and an opposite of all of these signs we're talking about is the aspect of feeling happy. Mr. Huggins, you talk about people giving away their possessions, giving away their stuff, but how about the persons, because there's not a telltale sign on some people's face. How about the person that is smiling, that is happy. That person have already made a decision that I'm going to end my life, so they're happy with the decision. So they're moving along feeling happy, feeling a bit of euphoria for some reason, just feeling okay that that's the decision they'll make, and they're going around smiling and saying their goodbyes in a special way that that we do not understand that this is what is happening here. And next thing you hit a bombshell, that person committed suicide. So these are things a community needs to know as to what are some of these signs and how they could help an individual that is struggling, you know, with depression or with suicide ideation.
To build on that, we know the fact that people, because of the stigma associated with mental illness, people wear masks.
Oh yeah.
So even though they may feel depression, they don't want people to ask them, why are you looking so sad all the time? So when they're out in public, they have a smile. They're showing that face and everybody thinks they're happy, but inside they're sad. And we see cases like, for example, the late Robin Williams, who shed so much laughter and joy with everybody. And inside, I mean, look what it led to. Right, and he's not the only one. There are lots of other cases like that. People are very good at masking what they have inside, simply because they don't want to go through the burden of having to talk to people or deal with it. So the person you see on the street sometimes that seem to be the most joyful, joyous person might be the person hiding something inside. So it's difficult, like I said, sometimes to just take a cursory look at individuals and make a judgment. You have to get to know them. You have to seek professional help when you need to. And you as an individual have to understand at one point when there seems to be that sort of discrepancy between what you presenting and what you're feeling, that understand that, you know, there might be an issue and maybe I should talk to somebody. And therapy doesn't necessarily mean going to a psychologist and getting medication and being sent to mental wellness and have to stay there and whatnot. Speak to get a psychologist, go to a private counselor, talk to them once a week, just share with them your thoughts. They'll help you process it. You know, there's no problem with that. You know, simple self-care techniques, doing little things that can help you manage what you're going through. So, you know, it's not a process, like I said, that has to be so extreme to the point where you're medicated and subdued to a bed or something in that case.
Exactly.
You know, and there are options, and they're like the hotline, the helpline, you know, there are anonymous options you can use as well.
Social support is a key aspect as well. Having persons you could reach out to. So sometimes, I mean, we cannot discredit professional assistance, but sometimes if persons feel that they could talk to a family member or friend or some form of peer support group, that could be very effective as well.
But you know what they always say? I don't want to be a burden to them.
Right, well,
that's why they But they have to understand that it's not a matter of being a burden. If you're a friend of mine, you're going through something, it's not a burden for me to be there for you.
Right. But I think in terms of the mutual understanding, I mean, that should be there. But then, and that is also part of the support we provide, because we don't only provide that support for that one individual, but for the family members as well, to help educate them as to how they could support that individual.
And the whole aspect of social support is, and I like it, because even in St. Lucia now, a lot of people are suffering. A lot of people are going through mental health challenges, and their friends are talking to them. You know, they're reaching out on social media. So there is a degree of social support now, but we're here to let you know that there is more that you can do.
I do believe that with the younger generation in particular, we've seen some growth in that area, because we have a lot of celebrities, a lot of persons who are very open about their mental health issues. So I think with the younger generation, there's a little bit more acceptance of, you know, what it means to be mentally well and getting help. A little more acceptance of what it means to see a therapist and get that type of help and things. That's one thing. We're not quite there yet, but I do see, you know, some level of improvement.
Okay, so one of the myths about suicide is that anybody who commits suicide or tries to commit suicide just wants to kill themselves. But in reality, it's actually that they want to end the circumstances that they're currently in. And we know that drug and alcohol does alter your reality in the moment that you use it. And these are some of the things that people turn to when they don't feel the way they want to. Can we speak about Turning Point and the services that we offer for anybody who is currently on a substance, using something that they find is affecting them too much, or in a way that they're afraid they'll not be able to function without, and how it would assist them in suicide prevention if they are having those thoughts after using those substances.
Right. So let's connect with the suicidality and substance use first. Some data that suggests that, like I mentioned earlier, one of the highest risk factors of suicidal ideation and action is depression, in particular, of all the mental health issues, and substance use, right? As Bradley mentioned earlier, heroin is closely related. Thankfully, we don't have much that kind of use down here, but we know alcohol. Some research is that alcohol is actually, persons who use alcohol can be 7 times more likely to, I'm trying to remember if it's to actually attempt suicide or if it's to have suicidal ideation. I can't remember what the stats specifically say, but it's a severe risk factor, right? And we know also that drugs in general have a tendency to affect the way that you think. So if you're already in a state of depression, and as Mrs. Edward mentioned earlier, some people may use drugs as a self-medication because they feel ill, and when they use the substance they feel better. But the use of that substance might help to amplify some of these feelings or help to alter their thoughts in such a way that they make decisions that are not for their best. And like I said, they may do risky behaviors, drunk driving, other things. So all of these factors come into play, right? They may even use the substance as a means of attempting or committing suicide, right? So in general, again, even if you're a person who has mild depression or just minor problems, the use of these substances might actually lead you to a point where these problems become worse. So you spend all your money on drugs and alcohol, and now you're broke, you can't pay the bills, so now you have more stress compounded to whatever the issues you had previously. So we do know there's a heavy correlation. As to a causal effect, I can't really say, right? But we know that there's a heavy correlation between substance use and suicidal ideation, suicidal attempts. But what it is that when people come to Turning Point, the goal here of Turning Point really and truly at the end of the day is to empower people. If I had to say just one thing, that is it. At the end of the day, to show people that you may have fallen into a life where you felt that this drug use is all that you had. The only thing that could help you deal with situations or help you feel good, or was the only thing that you could do, right? We're there to basically empower you to recognize that I can actually live a good and fulfilling life without this, right? I can turn away from all the harm that this has. I can recover from that. I can make amends, and I can move forward with my life. And we do that through a number of things, like psychosocial team with a biopsychosocial team, with a spiritual component, right? So it's a holistic thing. We have Mr. Joseph, as I mentioned earlier, social side. We have a counselor. We have our RCAs who do the 12-step spiritual program. And we have our nurses on staff and the medical doctors who come in a couple times a week to check on the clients. So they're covered in all areas, right? We go through daily programs. We help them find their life again. We help them fall into a pattern of care for themselves. Just basically going through the routines, the different programs that we have in the day. Basic things like doing laundry, taking care of themselves, good hygiene, back to good nutrition, all of these factors and things. And we get them to a point where they can feel safe and confident and say, within that space, and say, all right, now I'm ready to take on the challenge and be able to go out in the world with our continued support and become thriving, contributing members of society again.
So another important thing we didn't mention is the aftercare, because you don't just leave them and put them back in the society.
Not.
There's the whole aftercare where you're concerned about that individual, because if there's a relapse, it can create death. And it could be death by suicide. Like, I tried this, I went to Turning Point, I tried this and it didn't work out, I'm just gonna throw in the towel. But we do not end there with the client. It continues on by finding out how that client is doing, how they integrated back in society. If it's possible, we try our best not to let them go back into the same community with the same old friends, whether the same old behaviors can be perpetuated. Yeah.
So even with the in terms of the psychosocial support as well, so persons who are going back out there into society, first of all, maybe one of the main reasons or the main factors was the financial aspect, job aspect. So that's why in terms of the psychosocial component, we help provide them with employment, connect them to the necessary resources as well, in order for them to basically get their lives back on track.
Okay, and we did mention that family is an important part of that
Yes.
recovery process. So what are some of the things that maybe some family members should expect from a program if one of their close relatives is in the Turning Point program? What is maybe one or two things that they can expect from the program while they're being treated?
Well, one thing they may be called upon to be part of a group therapy session. So there may be issues or things that we need to resolve with them, so they can participate in that sense. And in addition to that, helping them understand what substance use disorder means and how it affects the individual, its impact on not just them but the family itself. So they have a greater understanding of what is happening and how they can help, what things they can do to support. It could be as simple as, if you know the person has an alcohol issue, don't have wine and stuff lying around the house and little things, but we get them involved so that they understand what's happening.
Okay, thank you very much for joining us. We will be on a break right now and we'll get back right into it when we come back.
She's been watching, waiting, wondering when the sands of time will give way to a tide of change, and for yesterday and today to become a new tomorrow, for a time when her sun can kiss the cheeks of your loved one and her stars can twinkle in her honeymoon skies, when her earthly embrace will reassure and calm your soul, and her unique view can change your whole perspective. Proudly, she has risen to meet new challenges and to provide safe harbor to all who reach her shores. For her hopes and dreams still stand shoulder to shoulder, a precious reminder of experiences yet to come. So, wherever your moments and memories take you, let her sense of adventure set you free. She is Saint Lucia. Let her inspire you.
Welcome back to our panel discussion, Suicide Prevention, Creating Hope Through Action. This evening you are with Millennium Heights Medical Complex, and we have three professionals, a social worker, a clinical counselor, and a program lead for Turning Point Rehabilitation Center. We're here to provide you with as many resources as we possibly can through the television, and also give you recommendations on how you can prevent suicide for yourself or a family or friend. This evening we have a slightly active comment section, and there is someone who is a bit concerned about another commenter, and I did request that our panel just encourage this person and let them know what they should do right now in the moment if they are having suicidal thoughts.
Well, one of the first things, if that individual is reluctant to reach out to 203, they could at least let someone know. Because in that moment, maybe you may not have the support, or not the support, but the strength to reach out. But at least letting a family member know, at least someone you could confide in, so that at least that individual could help find that support. But in all aspects, the best thing to do would be call 203 or come into the wellness center.
Yeah, and I want to let the individual know exactly, no matter how much pain they're in right now, they're experiencing right now, they're not alone. The individual is not alone. At some point in most of our lives, we've experienced some sort of distress and maybe some sort of suicidal ideation. So you're not alone. Speak to somebody you trust. If not, just call the helpline, like Mr. Joseph said, because they're available 24 hours. They're ready to pick up the phone as soon as you call, and they're just as qualified as us on the sitting here tonight. So if you're experiencing any pain, you're not alone. Please call, and we're there to help you. The staff is there to help.
we should note that we're not able to treat people who are commenting on social media. We are not able to offer expertise over the television or over broadcast, but we do have resources available. Like everybody else said, please call 203. It's completely free of charge. And while we are on the topic, I do believe, and we all do, that there is a stigma, not just with suicide, but with the National Mental Wellness Center and Turning Point Rehabilitation Center. And let's talk about it right now. What can people expect when they come to see us, and what would you want them to know about us? That we're not scary, we're not going to lock them up. So anybody take
and it's a word that gets around. Go ahead.
Well, one of the first things someone told me is that a few persons, they indicated, they said, hey, you're drain blood at Turning Point. So I was like, what? Drain blood?
So many years that rumor is
They drain the blood to clean out the
rumor
individual.
is we drain the blood, we clean the blood, and return it to the body, so they're no longer an addict because we've cleared the substance.
But that's far from the truth. You understand?
That's not what detox is. We specialize in what we call subacute detoxification, which basically means that we put you on bed rest for a number of days. We feed you, we give you water, nutrition, medication, everything you need. We allow you time for the drugs in your system to pass until they exit your body in a safe and monitored by medical professionals. So particularly when it comes to alcohol use, the detox process can actually be deadly if not monitored properly. So what we do in that case, the staff monitor you very well. They ensure that there are no what's the word I'm looking for? No deadly or fatal outcomes. And basically, once you reach a point where the substance has passed your system and you're feeling strength again, then you join the rehab program and participate in earlier activities. So that is what subacute detox is, and that's what we offer.
And don't forget, during that period, I think they manage the withdrawal symptoms as well. For example, symptoms such as shaking, hallucinations, and so forth. Because, like I mentioned, it could be deadly.
And the National Mental Wellness Center.
So I've heard that once you come there, they keep you. That if you come to the wellness center, they'll keep you and they'll put you with all the other persons that are not that have mental illnesses. I've heard that. So people assume that, and that's why a lot of people do not want to come to the wellness center. But when you come to the wellness center to get treatment, the only way that you can be kept, the only way, if you are a threat to yourself and a threat to the society. For example, in terms of killing, in terms of weapons and these kind of things. That's the only way. But you come to the wellness center as an ordinary St. Lucian, an ordinary individual having suicidal ideations or feeling down or having some mental health crisis at the moment. You come and you go to the wellness center, you see the nurses check your pressure, they check your vitals, and then you see the psychiatrist. When you see the psychiatrist assess you to see if there's any, if you need medication or if you don't need medication, and then you refer to the counselor. So this is the process, this is what happens, but to say that you kept there, it doesn't work like that.
Okay, so I hope that some of our listeners do feel a lot more comfortable, and we do know that there are people who may be feeling that they need to visit us, but their families encouraging us that we won't treat them rightly.
The stigma is so strong, sorry to interrupt, because I've heard people indicate that coming to our compound, even as a visitor, to come to somebody who's there,
keep you.
From the time they step off the bus by the gate, the other people in the bus watching them like,
funny.
So they have this thing where even to take a bus to come there, they don't want to do that because people are already watching them like this person must be, and to use a word that we try to avoid, must be mad or crazy or something. So we've had clients who come for assessments at Turning Point, having to walk by wellness and indicate that they don't want anything to do, they will not come for treatment because we're next to be clear, Turning Point and wellness are two separate departments while interconnected, because many persons who have substance use issues can also be what we call comorbid, meaning that they can have a substance use issue in addition to a mental ill health issue. It could be an emotional issue like depression or whatnot. It could be another issue like schizophrenia or whatever, or personality disorder, right? But the point is, a lot of people have that comorbidity, right? So, which is one of the reasons we like to keep the resources close to each other, right? So we can manage everything, whatever the issues they have. If we're treating the substance issues, they can also receive medication if necessary for their comorbid issue as well, right? But just the fact that they're walking by that area, people tell you, after they come to the cell and tell you, I'm not coming here because they don't want to be by well, they don't want to be associated with all of that, right? And that's the issue we have, is upon getting people to understand that, first of all, there's not an issue with having a mental health issue, right? It is just something you have. If you have a cold, you're not going to be embarrassed about that, are you? Right. It's just, that's just a fact of it. It's just something that affects some people, right? So when you have that thing is affecting you, you go and get the help for it. If you break your arm, you go to the doctor and get it, go to the hospital, you get it patched up and fixed and whatever. It's the same thing if you have substance issue or mental health issue, right? And it should be treated as the same. And we want to be able to get people to that point of understanding. There's no shame, no stigma associated with it. It's simply getting the help that you need when you need it.
And for the sake of anybody who might be listening, the Millennium Heights Medical Complex comprises Turning Point Rehabilitation Center, the National Mental Wellness Center, and the Owen King EU Hospital. We've been talking about our institution quite a bit, so let's get back on topic of suicide prevention and creating hope through action. Can we explain what is an impulsive act of suicide?
Oh yeah. So I could give you an example. For example, there is you're having a quarrel or an altercation with somebody, and out of the blue you just said, okay, and you guys say, you see me, I'm just gonna kill myself, and out of the blue you just go and you kill yourself. That's impulsive. That's an impulsive suicide act, and you did not think, you just did that. That doesn't mean that the person has a huge mental health condition, but it just means that person had tunnel vision at that point, which was fatal. So that's an example of what it is, impulsivity when it comes to suicide.
And substance use can contribute to that.
Definitely.
And also mental health conditions like psychosis.
I was about to ask, is there any more turning point related? Is there a different scenario that we might use, an example that you can think of in relation to substance use?
Well, you can get people who have issues, who have generally been dealing with certain emotional or traumas or other factors, who, having used a substance now and gotten to the point where they're not thinking clearly, might just at that point decide, now is the time I'm going to do it. Right? They had no previous plan or anything, so they would just had their issues, and then the substances have caused them to not think straight, and they just figure, why am I bothering? They go forth with the action. And it could be, in addition to that, like I said, it could simply be them deciding, I'm going to partake in some risky behavior that I would normally be in, which might lead consequently. So while they did not necessarily decide, I'm going to end it now, they decided to take on an action that was so risky that it was the likelihood of that outcome would be high. Right, so that's where it can come in, just basically clouding your judgment, making you not think straight or consider the repercussions of your action.
And one of the signs is reckless behavior. So this reckless behavior, because you just don't want to leave, So.
In other words, there was no preparation, basically.
No, they just at that moment it was simply.
Okay, so let's talk about some of the stats that we do know, some of the things that we do see in our institutions, both Turning Point and the Wellness Center, and even at Owen King EU Hospital, because the suicide attempts do come to the emergency room. That's where we see them. We touched on it a little bit earlier, the fact that more women attempt, from our data, attempt suicide, and more men go through with it. Can we just do a little recap of the statistics that we do have, what we do know about our country, no matter how limited it is, and from your experience?
So I do know that, like I said some time ago, the numbers were a little bit off, but from 2017 to 2020, we've had at least 43 suicides. And interestingly enough, and just like what all the data have showed all across in all the different countries, of course, that men are the ones who commit suicide more than women. And out of these 43 suicides that we had in these few years, only three were women, and the other 40 were men. And like Mr. Huggins also said, that they use violent means. So they have more lethal means of committing suicide than women. Women, when they think of committing suicide, most times there's a second thought, because you have to think of the children, you have to think of your husband, you have to think of, different things, the family members and so on. So there are other things that you think of when, and the attempt is usually not successful but men, because the lethality is higher than the women, men would easily take a gun and put it to their head and end their life, because that's what they've decided to do. And another thing also, suicidality is also high. So the men would kill the entire family and then kill themselves. So that's what you call a homicide suicidal. But according to the data that I have from Wellness Center, men, 49% of the men use hanging as their means for suicide, and the second highest rate, which is around 27%, is drinking Gramazone, drinking some kind of chemical to end their life. So that's the statistics that we have so far.
And to add to that, I may not have the actual numbers, but based on my own experience on the helpline, you have more women accessing the service as opposed to men. There's more women would call and speak about the issue. The men would be more reluctant. Even when reaching out to the family members, if we try to encourage them to call or to seek help, there's always a high form of reluctance when it comes to that. But you have more women accessing the service.
And then we did mention earlier that some of the reasons might be because of our cultural and traditional influence, of course. So what would you say to the women in the house with a man who may have suicidal ideation?
Well, that's where a certain measure of empathy would come into play, and encouragement. And I know for us men, our egos could be over the roof, you understand? But I mean, like Mr. Huggins said, I mean, if you have a broken arm, you'd seek medical help. You understand? So if there's an issue, if there's a mental issue, if there's an issue of suicide ideation, we strongly encourage persons to access that support, and we also would encourage family members to reach out to the helpline as well, and we ourselves could reach out to the individual. You understand? So if you're living with someone who maybe you may notice some of the signs that we mentioned, we would encourage individuals to reach out for help.
But I also want to touch on the men also a little longer, because the thing about it, men, traditionally, men were not allowed to express themselves emotionally. If we recall, I don't know how, Huggins, you and I are the oldest here. But traditionally, right, men were not allowed to express themselves emotionally as women do. If they cried, they would beat you for crying, when you were younger. So that's one of the things that we have to look at in terms of our own tradition here.
You say to man up.
Yeah, they tell you to man up. And again, men, even depression in men are not really diagnosed. It's not, men do not go to the doctor as much as women do, and so you don't know how many of them are suffering from depression, and that it's not easily diagnosed. That when a man for him, he has to take care of the family, he has to feed the family, and these kind of things. So, these are some of the things that prevent men from getting the care that they need in terms of their own suicidality and ideations.
Okay, so that was our last question. It's the end of our panel discussion, Suicide Prevention and Creating Hope Through Action. This evening you were with Millennium Heights Medical Complex. We had Mr. Bradley Joseph of Turning Point, Mrs. Alison Edward of the National Mental Wellness Center, and Mr. Robert Huggins, the program lead of Turning Point Rehabilitation Center. We encourage everyone listening tonight to share the information that you have heard, and please dial 203 free of charge if you have any difficulties with suicidal thoughts, suicidal ideation, or you know of anyone who may be suffering with it. We also mentioned that our services at the National Mental Wellness Center are open to the public. We do have an outpatient clinic, and we encourage everyone to please visit if they do feel like they need to. With that, good evening and enjoy the rest of your night.
Clear?
Farmers as possible to make life easier for them, to reduce the burden on the pockets in having to buy so